farmers think of themselves as being big, strong people, and on that basis, they don't see the vulnerability around their health. So we're trying to break down those barriers and encourage farmers to manage health, dare I say it, in the same way as they manage their livestock or whatever else, to manage their own health as well.
Hello and welcome to another episode of the HSE Talking Health and Wellbeing podcast. My name is Finola Colgan, and today we're speaking with Dr. John McNamara from Teagasc and Finola Colgan from Mental Health Ireland, and we're talking all about Farmer Wellbeing. To you, the listeners, thanks for supporting the podcast, and please give us a follow wherever you're listening to this episode and share it with anybody you think would benefit from it. So John, Finola, you're very welcome to the podcast today.
Honoured to be here, Fergal. Thank you.
Thank you very much for having us.
So we're talking about farmer wellbeing, and I know that we've been engaged together in a number of different partnerships over the last couple of years, and we're going to find out a bit more about your work in this area. But first of all, I guess for the listeners, why are we looking at farmer wellbeing? Can I go to you first, Finola, in terms of Mental Health Ireland? Why do you think farmer wellbeing is such a priority for so many agencies now?
Yeah, so thanks, Fergal. Yeah, I'm work with Mental Health Ireland, but it's about every organisation that's supporting farmers really. But why we're looking at collectively as a society and service provision in terms of mental health promotion of farmers, they're a unique group in their own communities. Their struggles, their challenges tend to be different and maybe from other professional groups. And then, like I was just thinking about it there as well this morning, it might be more difficult for them to access services, to access help when they're living in rural Ireland, and maybe it's not easy just to drop everything to go to see a doctor or to make an appointment. So this is a great way to reach out. We're looking at alternative ways of reaching out to farmers and chatting with them. And as you know, like the Farm Connect programme and on Firm Ground, these have all been very innovative, creative ways of engaging. So it's really about bringing Muhammad to the mountain rather than the other way around, say, literally getting out there and meeting with farmers and giving them that opportunity to understand mental health and their own well-being much better.
Yeah, and John, I know that you've been working in this area for many years now. How do you explain the importance of looking at farmer wellbeing to people?
Farmer wellbeing, first of all, it's being in good health and a feeling of life satisfaction. As you say, I've been working on this for maybe 30 odd years, and back in the early 90s, we did disability research, and we found that farmers had a lot of disability from cardiovascular, from cancer, and from injuries and musculoskeletal disorders. That injury was causing farmers to reduce income, putting them out of work, reduced off-farm employment. Teagasc's job is about economic sustainability, environmental sustainability, and social sustainability. So health and safety is crucially important to social sustainability. So we want farmers to have good health and well-being for its own sake, but also for sustainability as farmers.
And I can see, and from what I've heard, health and safety is a big component and big part of the rationale for the Department of Agriculture's increased investment in farmer wellbeing in recent years. Your work in Teagasc, John, highlights or seeks to address issues around farm safety, and unfortunately, there's been an average of 19 fatal incidents per year in Irish farms over the last 10 years. And tragically, there's been 8 confirmed farm fatalities to date this year. That's very sad.
Yeah, no, it's very sad. Farm accidents are at the coalface and they're very direct and happen. But poor health, it's like an accident in slow motion. It happens over time, by and large, and there's a huge amount of that. Now, as you say, health and safety has come to the fore both in Europe and in Ireland. In Europe, the European Commission is seeking to increase the whole component of social sustainability within the CAP. And our own Department of Agriculture, Food and the Marine are increasingly focused on health and safety and well-being. And as you say, they have a number of very positive schemes, on Firm Ground being one, Farm Connect being another.
Okay, so let's get into it about On Firm Ground. You both mentioned this initiative there. Finola, do you want to explain it to me about how we're working with farmers through the likes of the Men's Development Network and others trying to build the capacity?
Yeah, and other programmes as well. And I was really honoured at the time when On Firm Ground became established to be brought on board, because at that point in time, in partnership with Teagasc, we were the first partnership to kind of get out there and address the issue of mental health in farming. Because, as you know, Fergal, from your own professional experiences and that there is no health without mental health. And while lots of information about farm health, safety and physical health and that So then Firm Ground really focused through research, through evidence-based material to address the needs of farmers. What information do they need in relation to mental health? So it was about training up a number of advisors within Teagasc, because they're the people that are going out meeting with the farmers so that they can engage in that conversation and kind of break down the barriers. They're not going in purposefully to do that, but if they pick up a sign, or a farmer might say, I'm not in such great form, or they might say, maybe would you come and have a cup of tea, just to generate a chat. Isn't that it, John? Like to kind of demystify the whole thing. So it's about really bringing that whole message of mental health, no more than what we do ourselves, Fergal. In the HSE, you have a massive wellbeing program. You bring it to your staff. It's really a powerful program. So this is about us collectively bringing that program into the farmyards, into the farming community, both on site and maybe through collective meetings as well. And it's been very successful and it's now in phase 2 as well.
First of all, I'd like to acknowledge that Department of Health are a co-funder of the On Firm Ground programme. We're agriculturalists. We're trained in crop science, animal science. We've extension training in how to deal with people. There are health and safety modules, I'm delighted to say, in all the university programmes now. But we haven't a deep background in health or mental health. I think the Firm Ground fills that space. It provides solid training to advisors and rural people who are connecting with farmers, people who work in merchants and vets and so forth. It's available to anyone in that category. It really is a signposting program, how we can focus farmers on their health and the importance of their health, and particularly mental health, and particularly if there's an acute issue with mental health on the farm. So as Finola has said, agriculturists, and there are 800 advisors and consultants in the country, we're always meeting advisors. That's our job. And, we are a huge resource that can be used to leverage the cost of health and mental health.
Okay, so the conversations that Finola was talking about, there's training been offered to those working in the agri sector, so that they're able to enable all those health and wellbeing conversations, as you were saying, Finola, to infiltrate the farmyard and to socialise health and wellbeing with farmers.
Yeah, and it's, again, to complement what John was saying in relation to, it's not just about Ireland, it's across Europe. And we were fortunate enough in Mental Health Ireland to be a partner in a project called Farm Res. So it was about accessible resources for mental resilience. But the important point about that was about developing an e-learning app that farmers can access in their own time, in the privacy, because it's well known, and vets themselves will tell you that if they want to reach out to farmers in terms of their practice, the app is the way to go forward. And within that app, farmers can do a personal self-assessment of their quality of life. We initiated the idea originally with Farmers for Safety, and it's going to be a very useful tool going forward, because you see, if farmers don't get that information, and if we don't break down the barriers and the stigma, and just help farmers to understand, you do struggle, but so does everybody else. But your struggles are generated because of different factors in life. And as we've said before in previous conversations, Fergal, like I work with an organisation that has health and safety policy, workplace policies, EAPs and that, as you do in the HSE. But farmers don't have that access. This is where Teagasc and programmes like On Firm Ground, the Department of Agriculture, reaching out to get farmers, because at the end of the day, if a farmer is not well, let it be physically or mentally, the farm enterprise is impacted, the family is impacted, income is derailed, basically, isn't it, John? And it's very hard to get right back in there.
It is a very unique workplace in so many ways, isn't it, John?
Yeah, no, absolutely. No, the first thing about farmers, by and large, like their families really, and they work on their own. Now, there is an increasing number of employees, maybe in the dairy sector. No, it's a very hazardous environment. So really, the farmer has to be a health and safety manager for their own business. I think one important point that I'd like to pick up on is that, we've raised the profile greatly of health. Farmers need to realise that health is their most important resource. Teagasc, we run big events, beef events, dairy events, tillage events, and, we're putting that message out to farmers that health is their most vital resource. And I think it is increasing their awareness. But then we have our advisors and our training staff, and they're following up with more direct and positive conversations with farmers.
Again, it's all about partnership. So Mental Health Ireland, my colleague Kim, and your colleagues in Suicide Resource Officer, Rosaline and Emer, Mulligan in the Northeast, we've developed what we now call, we have them in the GAE Wellness Information Boards, but we've actually targeted the information on that board to go into marts and to agricultural stores, Teagasc offices. And see, it's about bringing the information to them where they can access it, because they mightn't access that information the ordinary way that you and I might access it. So it's about bringing that information and breaking down that barrier as well. I think that's crucial to it.
Yeah, absolutely. I take your point about trying to bring the information to where they're at, but also bring the information in a way that they can consume it. I see on the Teagasc website, there's lots of different podcasts made for different types of farmers that are deep in their own either, tillage or
horses.
Yeah. So you're trying to develop Teagasc as a norm, or trying to develop content in a consumable way for a very busy workforce. I want to come back to one of your points, John, around family, because we in HSE Health and Wellbeing have started working with farmers from a men's health point of view. But that's a bit unfair of a categorization. There's definitely loads of men working in farming, but everybody working in farming is connected to a family. So there's a family well-being dynamic that's tied into the workplace and tied into the well-being and the health and safety angle. Isn't there? John, you mentioned that.
Yeah, no, I did. We focus on farmers in the first instance, and I think that is right. We've got to, I won't say but we've got to encourage farmers to take responsibility for their own health. I think Dr. Noel Richardson, whom we all know, is very strong on that point. But family is an important support source, let's put it like that, around farmers, as are friends of farmers. So they support farmers to adopt health and mental health strategies. One big point that you mentioned there was workload. Farmers are busy. Teagasc, we're agriculturalists. We seek to get farmers to manage their workload and to manage their finances. They're big stressors on farmers that we can reduce. Now, we also, as advisors, we operate discussion groups where we facilitate, but farmers speak to farmers and exchange ideas. There is a lot of scientific research, including my own, along with colleagues, that shows that is very positive for influencing people's attitudes.
So that's peer-to-peer support.
Yeah. So first of all, we need to get farmers engaged themselves, male or females, but the people around them, their family, the friends, discussion groups, advisors, all those are tremendous supports. In the literature, it's referred to as the social ecological model, and around all of that at the top, then you have the HSE, the Department of Agriculture, government, and media, strong media initiatives. So the whole total movement should be towards influencing farmers to take health positively.
Yeah, and we might come back to that point. Finola, you want to come in on that?
When you're talking about men and farming and focus on men, behind every great man is his wife and behind her is his secretary. But like in farming, behind every great farmer is his wife. But the point is that there are women in farming now as well. And just in preparation for this, I came across a statistic that in the 10-year period from 2010 to 2020, there was a 1% increase in female farm holders. That was up from 12.4% or 17,345.
The overall point I would make is that we're trying to encourage male farmers, but also all farmers, female and male, to adopt health practices, and improve their well-being approach to farming.
Yeah, so there's a couple of points there, absolutely. So it's not a male-only message, and it's a farmer message. And then the other point that you're making, Finola, is that whether it's a female farmer or male farmer, there's a family, there's a context, there's friends. You're alluding to, John, you're stating that bigger sociological model. And that reminds me of some of the work that I suppose we've been lucky enough to get funded this year through the Department of Agriculture, Food and Marine, the new funding that was announced by Minister Hayden just a month or two ago. That's also seen an increase. The recent budget has seen 2025, the department is going to have an increased budget around health and safety and wellbeing, the Department of Agriculture I'm referring to. So it is positive that there's more and more kind of mainstream work going on for farmer wellbeing.
And also, I suppose, Fergal, as well, that the amount of families that are reared in farming that contribute to society because of all that they've learned from growing up in a farm, how to adapt, how to survive, how to be innovative, and they bring that to their work as well. Again, I was thinking about it, like maybe in the medical profession and various professions, they tend to marry each other. But usually I think when a farmer gets married, it's more than likely to somebody that's not a farmer. It's the dynamics that brings to farming. And I think that's what's really important, that we have to realise that farming is such an important part especially in Ireland, because I know we're like an international business and communities and that, but at the end of the day, like where we live, we're never too many miles away from the country, are we? And what farmers are doing to contribute to our food or everything.
Absolutely.
Could I make one very important point, Fergal? In our programs, we encourage farmers to gain a health check. We would like farmers, especially as they get older, to get a health check with their GP annually or thereabouts. First of all, you get the benefit of a one-to-one with your doctor, and they take vital measurements, blood pressure and so forth. But also farmers get into the hang of meeting their doctor and that. So let's put it the other way around. If a farmer hasn't been to a doctor for many years, then they have a mental health issue. What are the chances of them going then? The point I'm making is that a health check is very important. We would like to signpost farmers in that direction. And farmers sometimes argue with us. They say, well, I'm well now and, I don't need a health check, but, how do you know you're well if you don't get a health check? Now, when I'm on the subject, I think we should have more dialogue ourselves with doctors, medical doctors, to gain more engagement with farmers about their health.
Behind the On-Farm ground, bringing that training to public health nurses and various other paramedical groups that may be in contact. I suppose it's also reflective of the HSE's commitment to making every contact count. And all of this is happening because of the initiatives and the innovation and thinking, let it be through Teagasc, let it through your own department, Fergal, and that we're ready and open to get out there. And Teagasc and the farm groups are really interested.
There's so many. I was taken aback by the myriad of stakeholders that are out there in relation to the farm agribusiness or the agri sector.
Yeah.
It's a huge business in Ireland, and it's so important to our economy, our culture, as you were saying there, Finola. So having supports, and just as you were saying, John, having that clarity of message that we need to be preventive about this. There's no good being reactive about your health and well-being, that you need to get in early and see it as a normal thing to engage with the health service. That's a very positive message.
Yeah, that's a time factor though. And
it is.
It can be a difficult thing, and I can kind of understand it, like if you're in the middle of doing something, but that's life. And I mean, that's part of the family farm, and that's part of the survival, I think, isn't it?
It is.
Rarely can be.
Could I just mention that, Teagasc, I'm delighted to say we've done a good lot of research, over quite a number of years now. And maybe the point that comes out a lot recently is that farmers, particularly men, think of themselves as being big, strong people. And on that basis, they don't see the vulnerability around their health. And they don't go to the doctor. Maybe the reason they don't go in case they get bad news. So we're trying to break down those barriers and encourage farmers to manage health, dare I say it, in the same way as they manage their livestock or whatever else, to manage their own health as well. We need data, and Dr. Breda Smith, who was recently Chief Medical Officer, did an MD in this area and highlighted the high level of mortality for cardiovascular disease and cancer among farmers and that. And I'm just delighted to say that the USI have done some study that has shown some progress in the area. So I think over time we can make progress.
Yeah. So you're highlighting factors there: cardiovascular risk, mental health risk, health and safety risk, that we need to be aware of. But as you say there, John, the engagement has been very positive and there is some improvements that can be seen. Can we go back to some of the initiatives that you are actually rolling out and supporting? You mentioned the Farm Connect program, Finola. Would you like to tell us a bit more about that?
Yeah, that was a special research pilot-based project, evidence-based. It was co-produced, co-facilitated, and it was piloted in Roscommon, which was a great place to pilot it because Roscommon is a very rural community. Now, there was challenges in it to encourage farmers to come out and take part, but with incentives, with encouragement, and with Seamus really worked hard as a Teagasc advisor getting the families out. But they looked at just not mental health, they looked at physical health. They looked right over the whole, I suppose what you might call the total health plan. And then the other location for it was in Waterford. And again, you were kind of based on a rural urban area. Like undoubtedly at the beginning, it was difficult to get people out. But then as the message grew, there was no stopping the guys from turning up. And then they were quite sad because all these programs have a beginning and an end, and they'd gotten used to the idea of meeting. So Farm Connect was literally, because that's such an important word, connecting. isn't it? And linking in.
It reminds me of what John was talking about as the core of what Teagasc do through the discussion groups, is providing that peer support around a myriad of issues. And if you hear across a group about another man's struggle or another man's advice from his experience, like, you're literally getting it from the horse's mouth, as it were. So it's really powerful.
Can I just comment on Farm Connect? Currently, Men's Development Network are remodeling Farm Connect into smaller modules that can be introduced in a short, concise way at discussion groups. And we're going to pilot that. That's with a view to getting the larger Farm Connect modules in place, and the Farm Connect modules, there's 8 or 10 of them there. And, they relate to dealing with stress, your well-being, sleep, thinking about your health. It's a great program, but it's undergoing further development.
You're right to acknowledge the Men's Development Network. They've provided a lot of leadership, both in the program development on that program, the rollout and the development of On Firm Ground, but even bringing the partners together during COVID. I know, Finola, you were on a couple of calls. John, you were on a couple of Zoom calls with us as they were trying to bring so many of the allies together to say, how can we consolidate our thinking and our hopes around this?
Maybe can I mention one study that we've done now, and it's everything we've done, I'm pleased to say, is published, but we did a study on what farmer nutrition, right?
Yeah.
And we did it on the back of Dr. Breda Smith's MD, where she found that farmers were getting high cardiovascular. And basically we found that nutrition, in the follow-up studies, that nutrition and weight of farmers was a big issue, along with exercise. Funnily enough, farmers get lots of steps, maybe 14,000 steps a day, but they don't get the aerobic exercise. Trish Lockman, she's now in HSE, but she was in University of Galway, did an excellent master's in that area. We're pushing lifestyle issues and that. And it all also connects into mental health. Good diet is helpful for mental health. Exercise is good for mental health as well.
Kind of complementary to that is the 5 ways to wellbeing, which is an evidence-based strategy or practical ways for connecting with yourself, how you're feeling, how you're coping, connecting with others. Connect, be active. Like as John says, and I've seen it at home, they could walk 26 kilometres, but it doesn't feel the same. It's not like running a mini marathon or a marathon. And they don't get the same benefit from it. So it's finding activity at your own level. So connect, be active, take notice, maybe just take notice of how you're feeling. But I don't know, the farmers stop enough to look around. I know it might sound a bit lighthearted, but, just to stop and look at the nature in their own fields, in their own driveways, in their own rural just for even 10, 20 seconds. And of course, the seasons does impact majorly on farming. So connect, be active, take notice, keep learning. Podcasts like this is very informative. Programs like Farm Connect, the Farm Res Project, quality of life, all of that's so important. And the last one in that is the give. And usually with the give, they're saying give to others. Farmers give a lot to the community. They give a lot of their strengths, a lot of their achievements, a lot of their farming, everything. But it's very important for a farm family to give to themselves their own self-care. And I think that's the bottom line, isn't it, John, of all the wellbeing programs? It's about giving yourself quality time to be that good person.
What Finola has outlined there, the 5 steps, we produced a leaflet, Sowing the Seeds of Support, Positive Mental Health Guidance for the Farming Community. It's on our web, it's in our office. Mental Health Ireland have it as well on their line. So it kind of covers the whole gambit of farming. But there's a couple of issues like mental health, and health doesn't sit on its own. It relates to what farmers do in farming. And, if you're farming too long hours, if you're working too hard, if you're doing too much physical work, that affects your health as well. So the way you farm is important for your health. So the leaflet outlines farming ways of managing stress and improving well-being. If one hasn't enough income, that is going to cause poor well-being. So it deals with the farming side, but it also deals what we would describe as the signposting side, gives positive strategies to minimising health and improving well-being. And as Finola outlined, it deals with the 5 ways to well-being.
Okay, we're probably at that stage of our podcast now in terms of the signposting. John, you just highlighted your own website resources there. We'll put a link to them in the podcast information. Wherever you're listening to this podcast, there'll be a little information section. We'll include the links to both your websites. Is there anything else you'd like to signpost to as we kind of wrap it up?
the Farm Res, but also when we have that wellness information board that we're calling it for Farmer Wellbeing, that link to the information that board is going to be and bring people into the Teagasc, because that's where farmers go. That's where farmers get their information. And so the aim of that board is to bring it to marts, bring it to agricultural places, just put that information so that people can see it in a visible way.
Yeah.
And it's been co-produced as well, Fergal.
We've lots of publications on our web. We've another excellent one, Coping with the Pressures of Farming, which was done in association with Mental Health Ireland, and we Fit for Farming, which was done with the National Men's Health Centre in SETU, Carlow. No, but I would say to farmers out there listening, contact your advisor, bring up health and well-being issues for a short period, at a discussion group or at a meeting and that. We found that farmers, in our research, tend not to bring up health and well-being issues because it doesn't fit in with the good farmer genre. So we'd encourage conversation and discussion around health.
Absolutely.
And mental health.
Yeah, that's a nice way to sum it up there. Finola, last word?
Also to reach out to farm families if they're struggling and worried about their loved ones, like that they can reach out and get this information and alleviate their own worries and concerns, because often they're lost in that picture and don't know where to start. And I would occasionally get calls from family members, maybe a wife that they're worried, or a sister that's worried about a family member that's not coping, and they know it because they're not getting out, they're not going looking after their animals. They just know they're struggling. They can't get them to make that step to go to see the doctor. It's all of what we've talked about, but it's about supporting. A quotation I came across there some time ago, and I think it might sum up in some ways about how farmers struggle and farm families, but it's also about the positivity as well, that the nature of rain is the same, but it makes thorns grow in marshes and flowers in the garden. It's how do we view it? And it's very important that farming is respected, is recognised as a business, as a profession. Smart people running farms, and that we give them that credit. It's just not about milking cows, or it's just not about lambing or any of that. It's so much more, isn't it, John?
Yeah, I'd just like to maybe finish by saying that farming is a great career. No, you have to be a good self-manager. That's the crucial thing. The idea that all farmers are under stress isn't correct. Our research would show that about 12% of farmers maximum are under stress on an ongoing basis. The type of stressors that affect farmers are workload, financial, and there's concern about changing from production to more public goods and having a lot of paperwork to do. But the point I would make to go with that is that there are 800 advisors and consultants out there. There is a huge amount of support out there for farmers at the centre of it all, to put their health and their well-being at the centre of their focus.
Okay. I want to wrap up by thanking both Dr. John McNamara and Finola Colgan today for your inputs. I really appreciate them. And I'd like to acknowledge both the Department of Health and the Department of Agriculture, Food and Marine for supporting the ongoing work that we're referencing and talking about. And I'm delighted to say that we have an action in our new Healthy Ireland Men Action Plan, the HSE plan, that's working to develop an action around farmer wellbeing to create sustainability around some of these actions and create scale around the work that we're doing in partnership. So that's a very positive thing over the coming years.
Yeah, and I might add to that, Fergal, if it's okay, to thank you, because you've been an advocate for this, and you've recognised that men's health goes beyond just men in working places, working environments, but also in the farm. And I know John and myself, we go back a long way addressing this topic before it was even popular. But I know you've made such a difference, Fergal, to this, and I think it's a nice opportunity to acknowledge that for you as well.
Thanks a million, Finola. And I'd like to thank you both again, and I'd like to thank all the listeners for tuning in to another episode of the HSE Talking Health and Wellbeing podcast.